In this video, we'll explore mechanisms of injury and kinetics, understanding how accidents lead to injuries. Incidents can range from falls from heights to vehicle collisions. Every situation is unique and demands careful reading of the wreckage and understanding of the circumstances to assess the critical injuries, casualties, safety procedures, and priority of treatment. The first and foremost concern is our own safety as rescuers. Ensuring we don't risk injury is essential, as an injured rescuer can't aid patients. We must assess potential hazards including electricity, water, falling objects, and heights to ensure our safety. Next, we consider the patient's safety. Decisions must be made swiftly on whether or not to move them and how to do it, and if additional resources are required at the scene. These resources could involve the fire service, police, bystanders, or mechanical aids, and must be summoned as soon as possible. We then employ a jigsaw approach. Rather than rushing to address the most obvious injuries, we piece together the scenario. By observing skid marks, impact points, and other clues, we can form a picture of what happened even before reaching the patient. Bystander information is crucial to corroborate our initial assessment. It's important to ensure that their accounts align with our observations. This synthesis of data helps us anticipate where injuries may occur on the patient. As we build the bigger picture from the scene, the vehicle wreckage, and the patient, we begin to understand potential injuries. For instance, a side impact on a car could indicate serious injuries to a passenger if one was present on the impacted side. Our assessment starts long before we reach the patient, even before leaving our vehicle. Whether it's a car, fire truck, ambulance, or helicopter, we're evaluating the scene and determining which patient is most critical. Upon reaching the patients, we conduct a time-critical assessment of each, triaging the situation before starting our work. This process is crucial in identifying the worst injuries and setting priorities.